To other news now. If elected, National will pay for 13 new cancer treatments which are already available in Australia. Leader Christopher Luxon said it would provide $280 million in ring-fenced funding to Pharmac over 4 years to pay for it. The therapies would benefit those with lung, bowel, kidney, skin and head and neck cancers. The money would come from limiting free prescriptions to pensioners and people on low incomes. Everyone else would have to pay $5 per prescription, capped at $100 a year per family. Political reporter Lloyd Burr has more.
Dr Kate Clark's an oncologist long frustrated with Pharmac's funding decisions.
There isn't enough money.
Recently writing a letter to them pleading for critical cancer drugs to be prioritised.
We are increasingly frustrated at the disparities between the funding available in New Zealand and other jurisdictions.
National unveiling their plan to address her concerns.
National will invest $280 million over 4 years to fund the 13 cancer treatments the New Zealand Cancer Control Agency says provide substantial clinical benefit that are funded in Australia but not here in New Zealand.
There are 2 drugs for lung cancer, 1 for liver, 2 for bowel, 3 for kidney, 1 for bladder, 1 for head and neck and 3 for melanoma.
Let's get real about it. New Zealand has a 15% higher mortality rate from cancer than Australia.
They'll fund it by scrapping the universal free prescriptions policy, saving $619 million over 4 years. They'd introduce targeted free prescriptions for low-income earners and pensioners, including an annual family prescription fee cap of $100, costing $303 million. That leaves $316 million, of which $280 million will go to Pharmac to fund these cancer treatments.
That people who can afford to pay for prescriptions should, and those that can't should be supported and subsidised in the way that we're talking about.
Bringing those fees back in will lead to inequity of access and therefore inequity of care. My concern about cancer therapy and Pharmac being a political football is that it doesn't provide long-term solutions.
Patient advocate Malcolm Mulholland is welcoming the policy, but says it's proof of systemic problems at Pharmac.
What National have done today is stuck a sticky plaster over our embarrassing secret, and that is that many of those drugs that National have said they will fund today are actually on the World Health Organisation's essential medicine list.
Pharmac and their operation doesn't change at all. This is ring-fenced, incremental money.
I think we need to be careful as politicians about picking and choosing which drugs get funded.
The Prime Minister not happy Luxon wants to pillage his free prescription policy.
It's another smoke and mirrors policy from the National Party. They want to take medicine off one group of New Zealanders in order to give it to another group of New Zealanders.
As for whether Labor will fund these 13 drugs as well, Hipkins wouldn't say, which means watch this space. Lloyd Burr, Newshub.